I'm Dr. Goyal. I am an internal medicine physician and I work at the Center for Primary Care. I treat all sorts of adult conditions. Anyone who has any medical problem, whether it's heart problems, GI problems, lung problems, diabetes, as well as any acute problems, we treat all of those conditions. I had the option of going into some specialty, and I decided intentionally to remain an internist and to remain very general, because I really do like taking care of the breadth of medical problems that come to me.
I've had some intermittent swelling, but it's never both. It's one or the other.
About 80 to 90% of a patient's diagnosis comes from listening to the patient, about another 5% from examining them, and then a few percent more from all the diagnostic tests and scans that we do. Patients may have the opposite impressions that doing all the tests and scans is really what gives the diagnosis, but in the bulk of cases, that's not really true. So I do focus on listening to the patient, engaging with them in a conversation, and through that process, trying to help the patient with their symptoms and diagnoses. Sometimes patients come in with very troubling problems. They've been debilitated from panic attacks that have not allowed them to function at work, or they can't sleep, or there's a pain that's been bothering them that has limited their ability in their day-to-day activities. We have some treatment program that should enable them to go forward and be functional. So it's really exciting to see when that works.
Okay.
You can always monitor side effects and so forth. My idea of a physician was a doctor who took care of everyone, helped them with preventive care, their health care maintenance, but also dealt with any acute problems. And so that's the kind of doctor that I envisioned myself to be.